and welcome to PAC 14. I'm Sharon DeShiel, and I'm here with Wendy Waller. We are the co-leads for the Eastern Shore Mission of Mercy, which is taking place at the Civic Center in March this year, March 10th and 11th. And we'd like to share an exciting event with everyone who is watching. Wendy?
Sure. The Eastern Shore Mission of Mercy is a free 2-day dental clinic that's available to anyone over the age of 18. You do not need any insurance. You don't need any medical records. All you need to do is to bring a picture ID. The clinic opens at 7 a.m. Friday and Saturday, and it will close when we reach capacity each day. On Friday, if you are not able to be seen, you have the choice of coming back on Saturday. You would just need to come and stand in line again, unfortunately.
So if I come on Friday and I'm not able to get in on Friday, because it is first come, first serve,
Right.
what would you suggest that I do?
If you don't get in on Friday, you're going to have to come back on Saturday. We just don't have a way of holding people's places or banding them at this time. So we just ask you to go home, get some good rest, make sure that you eat well, that you're feeling great, because you'll have to, unfortunately, stand in line again the next day. And we just wanted to also remind everybody that we are only seeing people over the age of 18. We are not able to take care of children at this time, nor will we be able to watch over them for the patients. So that is an important thing to remember. And as we are reviewing this basic information, we probably ought to go over some of the things that we're doing to get ready for this event. Can you tell us a little bit more about that?
Oh, I'd love to. Especially because we have two fundraisers coming up. We have one fundraiser that will be held in Headquarters Live, at Headquarters Live, on Thursday, January the 26th, so it's right around the corner. Tickets are $10 in advance, and then they're $15 at the door. We will have fun bartending, and it's all going for the Mission of Mercy. The second fundraiser is a mystery dinner theater that will be at the Fenwick Inn in Ocean City on February the 18th. And if you go on our website at www.easternshoremom.org, and you can have additional information. Those are the two things we'd really love to have support for right now. The other thing that we will need from now until the event in March would be a lot of help as far as volunteers. We had as many as 1,400 volunteers in 2015. In addition to that, we would love to have donations, not only money but also in kind, because this is a massive project. Imagine the Civic Center arena covered with 130 dental stations, as well as x-rays, as well as sterilization, everything that goes into the process of having your teeth checked and looked at by a dentist. So those are the two things that you can do that would be most helpful, and then get the word out to patients that would need this service.
So can you tell us where we would find how to register to be a volunteer?
Right. If you can go on our website, they will then send you to another site that is RSVP, and it will bring up Eastern Shore Mission of Mercy, hence the ESMOM acronym. And you can register for a variety of placements. There are different shifts, so you're not there the entire day. You would come in. There are 2 shifts on Friday, and there are 2 shifts on Saturday. But what we really would love extra help with, obviously, would be the setup on Thursday and the takedown on Saturday afternoon. Many, many, many positions are still available for volunteering, and we have given a description of what you would do as you volunteered if you were willing to volunteer in those particular areas of your preference.
That's great. And one thing that we would want our viewers to know is that even if they haven't done this before, there will be an orientation process, and part of the shift actually incorporates the orientation time.
Exactly.
And so they'll be greeted and told what to do, where to go, and so forth, so that they'll feel comfortable and ready to start the shift.
And there's always going to be somebody there to help them, because we have the professionals, obviously, as far as the clinical side of this project, but we also have other people that have gone through this process, in other areas of the state and in other states, because Eastern Shore Mission of Mercy is not unique. If you go on the website, you Google Mission of Mercy, you will find that they are in many, many locations. So we're just very fortunate that it's here on the Eastern Shore, and this will be the third time that our dentists in the Maryland, Delaware, and Virginia area have volunteered their services.
And in fact, that's one thing that's so inspiring about this project is that we have people who really make it a part of their lifestyles
Right.
to come and serve in these missions of mercy. And in fact, we have a couple that's going to be visiting us soon from Florida. They head to Florida in the wintertime and then they come back and make a special trip up here just to help us and organize us and actually serve as leads.
Right.
So that's a very exciting and thing to have happen, and we're looking forward to seeing them soon.
This makes a big difference when you have this type of a commitment on both sides. And again, we have with the community side, if you hear this term community side and clinical side, the clinical side obviously involves the hygienists and the dentists and the oral surgeons and just every conceivable part that you can think of regarding your teeth. The community side, this whole project would not be able to take place if we didn't have the support of the Community Foundation, and they are just absolutely wonderful in terms of advice and helping us and advising us in terms of how we should do things properly, managing it, the finances, so you can be very secure in knowing if you make a donation that it is made to the Community Foundation. And that has huge credibility because they believe in us as we believe in them. In addition to that, we have many in-kind services that have been provided in the past, not only in time.
To the
but
tune of $175,000. We've had an
Exactly.
in-kind donations.
That's right. That's right. In kind. That doesn't include the dental time or the clinical side's time that they put in, nor the volunteers like ourselves at the time we're putting in, because you become passionate about this project. It just takes hold of you. And you want to help people that don't have the ability. And this is not just for someone that you feel is downtrodden in the community. This is open to anyone. We all know that health insurance is a very an expensive proposition nowadays. And so this is open to anyone, but no one under the age of 18. We're sorry, but we just can't do that. So when you come and you register, and the process is you stay in line, and then we take in the first, based upon the clinical side, we admit the number of patients that are standing in line, and we cut the number off, and then they come into the Civic Center in a very organized fashion. The Civic Center has been very helpful in that. We also need to thank the community, the Wicomico County, for their support financially, as well as helping take care of some of the expenses with the Civic Center. So we are most appreciative for the support we're getting from Salisbury, from Wicomico County. And again, we reach into Delaware and Virginia, and we have people coming from all over.
So our viewers might be interested, if they're looking to have some dental work done and they would like to come to our clinic, they might be interested in knowing a little bit more about the process as a client. So I wait in line, I actually come in, and then could you just give a brief overview about what might happen in terms of the flow and how they would be treated?
They come in and they are registered first. Now, we don't want to discourage anyone, but there may be pre-existing conditions that may not allow you to participate in the clinic, and that will be evaluated by a professional. But you would come in and they will take x-rays, then you will go to a screening, a medical screening, where they will evaluate what your needs are. And then there are x-rays taken, and we have waiting areas set up, and you will be escorted throughout. You are not going to be left alone or on your own. You will be escorted. Any questions, any concerns that you have, there will be someone there available at all times. Then you will be taken onto the clinic floor, which is the arena of the Civic Center, and you will have the procedure done that has been determined by the professionals. We're hoping to allow 1 hour, depending upon what happens with each patient. And we hope to see over 1,000 patients in 2 days. So it's an absolutely remarkable event.
Long shifts for the dentists
Right.
and the hygienists that are working and the dental assistants.
Right, right. But they give it their all, and they do this everywhere, it seems, so it's nice.
We're hoping to see about 1,000 patients, maybe 1,200 patients even,
Hopefully,
over 2
right.
days. And we'll have about a need for 1,400 volunteers.
Yes, yes. We still have a lot of slots, so we really encourage you to go to our website, and that is, again, www.easternshoremom, no periods in there, .org, and you will be told and directed where to go to volunteer. And again, when you go to RSVP, don't become overwhelmed, because sometimes it can be a little, scary, I guess is the best way. But you have so many options in which you can participate as a volunteer. And we need your help. And we also really need financial donations as well as in kind. So it's a wonderful big package. You viewers, each of you should be able to find a place that you are comfortable participating in the Eastern Shore Mission of Mercy.
And we look forward to seeing everyone,
Right.
as
Thank
many
you.
as possible, all of our friends, family.
We'd now like to welcome Dr. Greg Allen, who is the General Chairman for this wonderful Eastern Shore Mission of Mercy project that's happening in March at the Wicomico Youth and Civic Center. Welcome, Dr. Allen.
Thank you for having me.
We'd like to share with our viewers some of the pieces of this mission that are related to the clinical side.
Well, thank you for having me. I
You'd like to
appreciate
give us
that.
a little background on why you're involved with this project.
The Mission of Mercy is very near and dear to my heart. Years ago, the first mission the first mission in Salisbury was started because it was a Maryland State Dental Association initiative. And we got together and we realized that there was a need in the state of Maryland. And the first one to come to Maryland was actually handled in Western Maryland. Diane Romaine, the sitting president at the time, brought the first one into the state. Since then, I think we were the third here in the state of Maryland to host this event on the Eastern Shore. And it really was an effort by us as dentists to try to help the underserved population in the state of Maryland. As a unique aside, we did some data and looked at some research, and here on the Eastern Shore, we are the #2 spot in the state of Maryland, and it varies. It goes, sometimes we're #1 as far as needs assessments go for both. It was children and adults, but thanks to some wonderful changes over the last 5 to 7 years, the children now are being taken care of to a large degree on the Eastern Shore. And that's why we are not currently going to include children in our event, because we do have some safety net projects available to people here on the shore for their children.
Now, you mentioned we've had this twice on the Eastern Shore here in Salisbury, 2013 and then again in 2015. What changes did you experience or witness, and what successes?
We are just a working project. We're in evolution. And I tell you, the first time we ran into some issues. We had a lot more people than we ever expected. The first mission, we had to turn away approximately 1,000 patients. And we understood there was a need. We didn't understand the depth of the need here on the shore. The second mission, we got a little better. So we figured out how to control the amount of folks coming into the clinic. And as you guys had mentioned earlier, we're getting better and better at controlling how we're going to handle, so we're not going to have patients waiting in line as long as we did the first 2 missions. We've also gotten much better clinically and with the logistics within the clinic, so we can treat more patients more efficiently now.
And there will only be 3 procedures available, correct?
That's exactly right. We're planning on our #1 purpose for the Mission of Mercy is to alleviate pain and suffering. That's first and foremost. So it's probably the bulk of what we're going to be doing, probably removing painful teeth. Right behind that, we're going to do some fillings. If any dentist on the shore here and in general, if we can save a tooth, we always try to save a tooth, and we'll do our best to do that. So if a filling is possible, we'll always place a filling. If a filling is not possible, then we have the option of taking the tooth out or extracting it. And the third procedure that will be done is hygiene. We're going to try to clean as many people's teeth as we possibly can, as well as try to educate people as far as how to take care of their teeth in the future.
Now, how do you handle educating the people that are on the premises?
We have a fantastic group of hygienists that have helped us the last couple of missions. They're going to come out in droves, and we're going to have an educational area set up just specifically for that purpose. As well as the hygienists are cleaning your teeth, they're going to talk about dental care and what you can do to maybe prevent this from happening again, and maybe even point out some things that they could possibly address early on so that we don't end up having to see them again in the Mission of Mercy.
We mentioned before that some patients would have to be turned away. Would you elaborate on what conditions may create that situation?
Yeah, usually, Sharon, there's very few. Things that come to mind immediately would be somebody who is on blood thinners, and I don't mean aspirin or even Plavix, probably Coumadin, and some of the newer blood thinners that are available out there. Those patients were concerned about bleeding, so that this probably wouldn't be the best setting to treat them in. The other things we need to mention are diabetic patients, and we have quite a few diabetic patients that we see in our private practices, and it's as far as populations go, there's a fairly large population of diabetics here on the shore. We want to make sure that those folks eat appropriately, take their insulin as they normally would, and but there is no really contraindication to care unless they are really a brittle diabetic, and that will be made at the clinic at that time. But we would encourage even diabetic patients to come out. We can probably treat you. Also, it's important to mention that.
Now, you were talking about some of the reasons you have passionately signed on for this. Can you share with our viewers just how much in kind, or I guess time, that you have given, you and your other professional cohorts that give to these Mission of Mercies all around the state as well as here?
Yeah, I mean, we started. It's hard to put into words, Sharon, the amount of time and energy something like this is taking, but I'm telling you, it is worth every minute that we've spent. I can honestly say that. This planning process starts literally 2 years in advance. We offer a Mission of Mercy here on the Eastern Shore every other year. We decided at the state level, the Charitable Education Foundation is the branch of the Maryland State Dental Association, that we were concerned that we were going to lose our volunteer dentists and lose our volunteer hygienists because we were trying to do too much. So we've decided to space these clinics out every 2 years in different parts of the state. Now, so the Eastern Shore Mission of Mercy will happen once every other year. Really the planning starts within about 3 months after this mission is done. We will start preparations for the next one, which will be in 2019.
Okay.
So.
Now, as far as volunteers and donations, we've talked a little bit about the community side. How does that impact the clinical side?
We will need approximately $125,000 in cash and in-kind donations to support a mission like this, okay? And that's bare bones. We have some wonderful vendors that are helping with in-kind donations, but we need every penny we can get. Fundraising is getting harder and harder in this day and age, especially with the economy the way it is. But every one of those dollars that we take in is spent in a very efficient manner, and we really want to try to encourage our community to give in many ways, not only monetarily. A $5 or a $10 donation will go a long way towards what we're trying to accomplish, as well as a $10,000 donation. We've been very fortunate over the last several missions on the Eastern Shore to have some support from some insurance companies. Blue Cross and Blue Shield's been one of them, who has really stepped up to the plate and helped us with several large grants, as well as other members of businesses in the area that have really helped quite a bit. But we've also seen a lot of donations from the local dental community itself and volunteers that help with the Mission of Mercies. So a $5 donation is appreciated as a $10,000 donation.
Now, you mentioned the involvement of the Eastern Shore Dental Society as well as the Maryland Dental Society. They support this, correct? What other roles do they play in this particular project?
Logistics are probably the biggest one. Each Mission of Mercy in the state of Maryland is independently ran by the local dentist. There's several components around the state of Maryland of dentists. Our component happens to be from the Eastern Shore. The Eastern Shore component starts at the Bay Bridge and goes all the way down to Virginia and over to Delaware. So we as a group belong to the Eastern Shore Dental Society, and we kind of spearheaded this initiative on the Eastern Shore. The same thing happens in Western Maryland. And what happens at the state level, because we're all members of the Maryland State Dental Association, we have sat down and kind of hammered out some logistics to help treat as many patients as we can as efficiently as we can. And that's our goal, is to try to distribute the care over the state of Maryland. Now, it's important to mention that just because we're on the Eastern Shore of Maryland, we welcome Delaware folks to come over. We welcome Virginia. We've had people come as far as Florida to be treated at our Mission of Mercy. And we're looking this year for some support from Delaware dentists. They've helped in the past, and we're looking for even greater support. Because if you look at our numbers, about 30% of all the patients that we're seeing at least 30% come from from Delaware. So, and Delaware hygienists have been on board with this from day one as well. So we've gotten a lot of support from surrounding states too.
What could you share with our viewers regarding the dentists and even the hygienists, since they're already so involved? What would you share or request of our viewers if there are dentists out there in the Delaware area, Virginia area? What should they do, since you're tapping into all the dentists in the Maryland area?
Yeah, we would love for you to go. Actually, the best thing you can do is, even here in our area, let your dentist know about the event. If you're going to, if you're a patient, if you see them, ask them if they're participating with the Mission of Mercy, especially in Delaware and Virginia. It's a great. It's not only a wonderful opportunity for us dentists and us the oral healthcare professionals to get involved and interact with each other. It's also a wonderful event that we can interact with community and with several other venues in the area as well.
Now, the dentists that would be participating in this as well, would they contact you, or would they go on our website? How would you, and we also have a Facebook site as well. What would you recommend that they would do in terms of what would they need in order to participate in this project?
If they're a Maryland State dentist or a Maryland State hygienist, any healthcare professional in the state of Maryland it's very easy to participate. You would go to our website and register on the Eastern Shore the Eastern Shore MOM website. Okay. If you're an out-of-state dentist or an out-of-state hygienist who would like to participate, then what happened is you would still go to register on our website, but you very well might have to check with your local board and get what's called a temporary license to help out at our clinic.
All right, now these people would be signing up for shifts, because I know you are there for the duration. You're there all day Friday and all day Saturday.
Right.
But someone coming from out of the area would not necessarily need to make that kind of a commitment if they didn't have the time. They would be able to do a shift. They could sign up for a shift.
Dentistry is hard on the neck and back, so what we've done, we've broken the days into 2 shifts, about 5 hours apiece. That way we don't have to be so difficult on our dentists and healthcare professionals. And the great thing about it is they can always volunteer for 2 days. They can go half a day on Friday and a half a day on Saturday, and that makes it a little easier.
Well, we'd like to thank you, Greg, for joining us as the General Chairman. You have a lot on your shoulders. And we also would like to welcome all the viewers to participate in any way possible. There is a spot for you on the Eastern Shore Mission of Mercy that's taking place at the Wicomico County Youth and Civic Center, March the 10th and the 11th of this year. We will see you there, and bring all your friends. Thank you again for watching PAC 14.